What's up, everybody? This is Ian Smith from Summit Rejuvenation, and this is part number 1 of our multi-part series discussing testosterone and women. The title of today's introductory discussion is Testosterone. It's not just a male hormone. Now, most women have been told about estrogen and progesterone. Almost nobody talks about testosterone, yet women actually have more testosterone than estrogen circulating most of their adult lives. Now, women produce testosterone in the ovaries and adrenal glands, and it plays a vital role in things like sexual desire and responsiveness, energy and motivation, lean muscle and body composition, bone support, cognitive function and sense of well-being, as well as emotional regulation and stress control. Now, naturally, as you get older, levels will decline with age, but they can fall a lot faster after things like surgical menopause, premature menopause, and in a lot of cases, medications, including certain antidepressants and birth control methods, can send a woman's hormonal system into an absolute tailspin. One of the common reasons to use testosterone in women is hypoactive sexual desire disorder. In postmenopausal women specifically, which is a persistent low sexual desire with distress and often pain during sex. Others include shifts in mood, inability to keep off body fat, low energy, low drive, poor focus, and essentially all of the other symptoms that we see common in men with low testosterone. Now, this is not about guessing. So if you're experiencing any of these symptoms, it's important to seek out medical care from a provider who understands hormones. First of all, you want to look for somebody who's going to listen to your story and your symptoms, who's going to review medications, stress, and relationship, as well as psychological factors, and then ultimately use targeted labs as one part of the picture with all of this in mind. TRT is not about turning you into a man. It is about restoring the physiologic female range levels when appropriate based on evidence and careful monitoring. We're not chasing superhuman numbers, and we're certainly not trying to get you to grow a mustache. So here's the bottom line. Testosterone matters for women. If you're exhausted, foggy, and your libido has disappeared, it's worth asking whether low testosterone is part of the puzzle. Not the whole story, but a missing piece. That concludes all of it for today. This is just an introduction. We'll be covering it more tomorrow and the following days. We're going to answer all of your questions on this. So if you have questions, please drop them below. And if you enjoyed this, please share it, like it, and stay tuned for tomorrow's episode.